Rishikesh, I don't know if you are still with us. Thank you so much for being with us. If you are staying with us, please stay because a lot of people are here and we are taking up, we're going to be carrying on several other.
I'm with you. I'm with you.
Thank you.
I have a golf tournament tomorrow, so I have to join my buddies. So I'm on my way. So there will be a little noise.
Okay, that's fine. Thank you for staying. Thank you, and you can listen to where these discussions are going. Now, thank you all for joining us. This is just one of the many events that the foundation holds, and we will have many more events coming up. I wanted to bring Baswati-ji into this once again. Baswati-ji, you are
yes.
there. Please, if you just take us, we have time with us, so improvise, and please tell us.
I think there are several points that came up. I've been taking a few notes. I wish Dr. Jammi was still with us because I wanted to ask him to elaborate more about the Rasa Oshadhis, but I do feel that there's a place where you can, we can have a few different seminars come out from this. One would be on Rasa Oshadhis, and I would just love to have all four of these doctors who were running this particular session to come back and discuss Rasa Oshadhis, but not to do it in such a format of the presentation, but to have the entire time be discussions, because there are a lot of points that need to be heard and they need to be recorded. And I think Ayush Valley has this ability to have a seminar that gives all the salient points so that someone who is needing to learn about this can listen. So that would be a fabulous session to have. And these scientists and doctors and Vaidyas who are so well versed in the topics can speak about it. And I would also love to add a couple of points to it, obviously. But I think it's an important, what do they call that word? Disruptor that needs to just happen right now. And I do believe fundamentally from the core of my being that Rasa Oshadhis are the way out of many, many diseases. I use them in clinical practice. I use them in India. I use them in America. I use them around the world. I know how to do it using the loopholes so that I don't get into any legal troubles. And I know who not to teach about them, who would just be a complete, fiasco if they got hold of the Rasa Oshadhis and used them wrong. That kind of a warning about the ethics is something that wasn't discussed today. So that's a second topic that we need to talk about. And then the third is the finishing school that was brought up. I have talked about finishing school many, many times, having gone through modeling finishing school and knowing what that was about. We have seen that two groups tried to do a finishing school in India. One is a group in Bangalore. They charged 50,000 rupees to people who wanted to learn, presumably so that they could go out of India and work abroad. But the feedback I got from a few of those graduates was that it was not a well-run course. And the reason was that it was not done properly. It was not done by people who are actually aware. Whereas the people today who were speakers really do have that awareness and could absolutely participate in how to help people become articulate, knowledgeable about facts, and do their homework. The biggest problem that I found with the finishing school that was held in Delhi is that they did not demand accountability for homework. Certainly, we don't want to treat people like high school students where they have to do their homework or else they get penalized in their grades. But we need people to do the work that needs to be done. And there is to date no accountability for continuing medical education in Ayurvedic seminars. And so people attend. Half the time they're not listening. Half the time they don't have an attention span. And they don't capture the information that's taught to them. So we need a new way of teaching in these finishing schools that actually looks at the competence that they have once they go through this schooling. So I went to a class session, I guess I should say, in the CCIM series of seminars. They were, first of all, very rude to me, I have to say, because I'm not Indian, even though I fulfilled their criteria of having a degree of Ayurveda in this country. But when we got to the seminar, I was appalled at how many wrong things they were teaching. And so I very politely, very docile as I can be, pointed it out to them that if they were going to teach these people about practicing Ayurveda outside of India, they needed to teach them accurately. And the current president that was there at the time said, or director or whatever, the head of the group, said that, no, I was wrong, because the people that he invited to speak were very notable. Whether or not a person has, a credential, if they don't know how to practice outside of India, they are a danger to the field of Ayurveda. And that is what we see in the US. I think Gayatri can agree with me about this in Germany. And certainly I've seen it in South Africa. I've seen it when I live in France. I've seen it when I live in Canada. People regularly who are Ayurvedic practitioners living in those parts of the world will just cringe at every time an Ayush meeting happens or a conference happens where Ayush officials come, and they say things that just do not fit with the local people. They do not fit the way the facts need to be stated, because there's a lack of awareness about the laws. They do not fit the culture, and they deeply reflect ignorance about the way that other people live while they're using Ayurveda in different parts of the world. So I just wanted to put those things out there, Madan, and see what you think of that.
Thank you, Baswati. I want to bring Derek from Durban. Derek, are you still with us? Hello, Derek? Because I wanted to get this perspective from South Africa, just to get an idea. We have so many people here with us. So I'm going to run through this list of people who have contributed. Jose Dominic. Jose, would you like to just share your question? And as we go down this list, we have many people who have raised questions, but didn't get a chance to have them answered. Jose, are you there? Jose Dominic. Jose is not here with us. There is somebody with an instrument named Telephone Me. Who's this person? Hello. Who's joining us with signed in?
Vincenzo, Madame.
Oh, Vincenzo. Ciao, Vincenzo. Is that, how come we don't see your
Ciao.
name? Because I make casino with the telephone.
Anyway, thank you for joining us, Vincenzo. Could you hear our discussions and please add to it?
Yes, I hear all.
Ciao,
Bash.
Ciao, doctor.
Come stai?
Díganos. Tell us all what you think about today's discussion.
No, I think that is always very interesting. And we need, as for phytotherapy in Italy and Europe, integratori, many other biological active substances that are in use everywhere in the world as Ayurveda, apart the implementation of a purification of the process of the production, etc. But we must avoid the great mistake of homeopathy and the other natural drug or supplement that they are not with the side effect. We have synthetic drug have side effect, natural drug, Ayurvedic drug, homeopathic drug haven't side effect. It is a conceptual mistake, practical mistake, very, very dangerous for Ayurvedic, homeopathic, and phytotherapeutic drug, because all the active principles could be coherent or incoherent in their action. And if they are coherent, you can measure improvement of a function, bioelectrical status, positive effect on health, on immune system, and so on. Antibiotic effect, antalgic effect, anti-allergic effect. If the effect is not coherent, you have a side effect
Vincenzo,
that you can measure.
I want to interrupt here because I want to bring in Thomas Pfeiffer from Prague. Thomas, are you there? Thomas? Thomas, hello. If Thomas is there.
I think you should keep going down the list and see if they come on.
Okay. Now, the next one, Shefin. Shefin, are you there? Hello, Shefin? Shefin? Shefin, are you there? No, Shefin has left. Shefin, are you there? Hello?
Yes,
Shefin is coming to us from Trivandrum. Susanna, are you there? Hello? Susanna? Hello? No. Murlidas, are you there? Hello? Murlidas? No.
Hello?
Oh, Shefin is.
You know what might be better is to ask people to type in the chat if they'd like to say something.
Yeah.
And if they do type in, then you know that they are ready to be unmuted. But if you just one by call on people, Madan, you're going to have some people that are just not prepared because they have background noise or they're sitting somewhere.
We're almost to the end of the list. Let me run through to see who's here with us. Shefin, are you there, or is that Susanna? Hello?
Hello, Susanna.
Shefin?
I'm here.
Susanna. Hello, Susanna. Where are you calling from?
I'm in France.
Oh, thank you so much for joining us.
Bonsoir.
Bonsoir.
So welcome to the Ayush Valley, Susanna. Tell us a little more about yourself and some feedback from today's event.
Yes, actually, I'm an Ayurvedic therapist in France.
Mm-hmm.
I studied with Dr. Sajikumar this year in Kerala.
Oh, very nice.
Yes, with my student, Madan. Yeah.
Okay,
yes.
so okay. Now, Susanna, you know Kerala, you know France. What do you think needs to be done for Ayurveda in France?
I really would like to promote Ayurveda here in France. Now it's just the beginning because people are interested in, and I think it's going to grow this year and next year because of COVID and another epidemic problems, of course. Here in France, there's a lot of problem with stress and digestive problem. And I think Ayurveda is the better solution.
Your comment about stress and digestive problems, Susanna, is very important. Vincenzo is organizing a big event on both these issues, stress and GI tract health. And please stay connected with us. If you send us your email address, then we will keep you in touch with the activities at that Vincenzo is organizing in Firenze, in Italy, about both these areas. And Vincenzo has correctly said, used the term called coherence. And this is a very, very important area. So if you stay connected with us, then we will share information as Vincenzo's program evolves on both stress and GI tract health. Susanna, where are you located in France now?
I'm located close to Lyon.
Close to Lyon. Now, Baswati Bhattacharya, who's here with us, she visits France frequently. She comes to Paris. Maybe she can also come down to where you are and start some informal engagements on this area. So if you share your details with Baswati might send her details too by chat here.
Yes,
so that
of course.
Stay in touch. Baswati ji has a lot of connections both in France, and she connects a lot in America and in India. So she networks very much. So we are so happy that you have joined us. There it is, Susanna, your address. Thank you, Susanna Lopez. Thank you so much for being with us. Thanks to Hari for introducing Susanna to the group here. Jose Pinado. Jose. And we also have...
Hello.
Jose, hello. Welcome to the Ayush Valley. Where are you talking to us from, Jose?
Well, I am from Peru. I'm very, very far from you. I'm here in Peru take some preliminary studies on Ayurveda, but I'm medical doctor, and also I love a lot another types of medicines. But I think that we need here in this part of the world is that Ayurvedic studies can move a little more outside of India and come to our countries, because sometimes people comes here, but they only give some little conference and motivation.
Okay, I'm so happy now. I want to interrupt you with 2 or 3 questions here.
Yeah.
Where did you study medicine? In Peru, Lima?
Yes, Peru.
In the main university in Lima?
And I study in a main university, not in Lima and Trujillo, but it's very near to Lima.
Very near to Lima. Thank you very much. Number 2, have you completed an MD? Have you specialized in something?
Oh, no, I finished my complete career, no any specialization, but I started studies also in psychotherapies.
Have you been to India to follow the work that is going on in India in these areas in Ayurveda?
I don't travel India yet, but maybe sometime.
Thank you. So what is happening in the Ayush Valley? We are developing courses on online courses. Baswati is already doing several online courses. We would like to discuss with yourself a little more on how to evolve some of these courses. So if you share your email address online for everybody to get in touch, then that will be wonderful. We want to grow this activity so that we learn from you about what it is that will be most beneficial in your location, like in Peru. So Jose, please do share your email by chat so that we can record it, and then all of us can come back to you with some comments on this thing.
Okay.
Can I make a comment?
Please, Baswati, please. Okay.
Jose, in 2017, the ambassador of India to Peru, one Mr. Sanjeev Chakrabarty, had started a program of training Lima physicians with the university there in Lima about Ayurveda. And so he had invited me to come and give an introduction course that would just introduce people and get them ready. And we set up an MOU, actually. And that MOU is still in place, and it just needs to be pursued by the university people. So if you write to the email address that I wrote, I can possibly find the people who are in Lima that were in charge. Certainly, there has been some movement toward making that happen after Mr. Chakrabarty was transferred, as ambassadors only stay for 2 or 3 years. And so right now, there is a potential for a group of doctors who want to create a course. There are several courses going on. There are several physicians from AVP, which is the school in Coimbatore. They have 2 or 3 doctors that travel regularly to Chile, Argentina, and they set up a longitudinal learning course. So if you want to fly down from Lima once a month or once every 3 months, they have courses there. A second is one that I started in Panama City. And it's with a group of doctors who are actually Panamanian and Colombian, who are doing the course in Panama, partly because there's a huge group of doctors there that want to learn it, but because it's a very easy place to travel to. And there are several others that I know that are in some stage of training Ayurveda who are already in South America. So rather than trying to start something new, it would be great if you could network with them. The other option is that if you don't want to leave Lima, you could either get those people to come, and after they teach 1 weekend in one place, they can come to your place the following weekend. But the other is that if you don't want to leave, you could have a group learn online. So I have students from all over the world, and there are many people like me who set up the courses so that you can learn slowly and effectively from a physician. and make that happen. So you have to decide, as Dr. Madan said, you have to decide how you want to learn and how you want to set it up and how big the group is that you're trying to lead. And certainly, you know, there are many, many people who are teaching Ayurveda who are set and practiced and really good at teaching it, that can interface with you and your groups. Okay?
Okay. I know directly Mr. Chakraborty because I work directly with Embassy of India, because I also am a yoga teacher, so I do with Embassy many years International Day of Yoga presentation in a big groups. And maybe I know the student that's coming because I do maybe translation for this teacher here in Lima Embassy, no, when they come. But
yeah,
I
there
tell
was
you,
one, Dr. Pankaj, you met him, right?
yes.
So I know your name from Dr. Pankaj. He's one of our faculty at the Dinacharya Institute. So we trained him. He even came to New York. So I sent him to Peru to teach in that course for 2 weeks to your group.
Okay.
So it's very possible. Todo es posible. You just have to decide what you want and how you want it. And we can connect you either with the teachers that are already coming to other parts of South America or one specifically. It just depends on how you want to do it.
Okay. I think here is a big group of people that want to do maybe a serious, no small, but a big one course or formation, no? in Ayurveda. And maybe also, I don't know if Ayurveda also focusing in Indian herbs, because Peru also have a big different kind of herbs also.
That's right. And in fact, this is one of the issues that we started discussing, is that we need a doctor of Ayurveda who is a specialist in what is called Dravya Guna, which means the Ayurvedic herbal medicines. So we had sent Dr. Pankaj because he can look at the bhumi, which means the land, and he understands a lot about herbs. So he can look at the local herbs of the Amazonian or the Andean herbs, and he can help you to understand potential uses, and then talk with the curanderos or the people that know the medicinas hierbas, the medicinal herbs, and translate with them that this is something similar used in the Indian pharmacopoeia of Ayurveda, and how would it work in the Peruvian pharmacopoeia. And so those discussions were going on between Dr. Pankaj, and they are actually going on not just with Dr. Pankaj and Peru, but in many parts of the world where not ethnobotanists, but actual Ayurvedic physicians who are knowledgeable about Dravya Guna and its basic understanding of plants and how they connect to the medicinal uses in humans, they can go to places like Ghana or South Africa or Argentina or Peru, and they can work with the traditional healers and the medical doctors like yourself. So I'm not trained in Draviguna, I'm trained in the pharmaceutics, which is Bhaishajya Kalpana. It's a related but distinctly different subject. But I have certainly knowledge of many Dravyaguna Ayurvedic physicians who would be so keen to take tours of the Lima, you know, the outskirts of the Andean mountains, and to see and to show you how the medicines work. And I think that kind of a teacher is what you want, because they will help you to interface the knowledge of the herbs that are local with the principles of Ayurveda, which are not allopathic, but they work on things like the 5 elements and the doshas and dhatus and shrutas.
Thank you. Thank you, Jose. Thank you so much for joining us. We have your email address now, and let us stay in touch. Please feel free to ask questions. Whatever the questions are, we will be able to come back with some good answers and good suggestions so that we can move this onward quickly. We have,
and I think there was a comment from, was it Dr. Dhamle that just commented that they have a complete chemistry of herbs of Peru, and they can do experiments.
Please, Rishikesh, please.
We have a algorithm for all gunas, dharmas, and what they do on human biology as well as chemistry sciences. And I can help it. I have a complete database of every plant including Peru, and it is possible for us to suggest some, 4, 5, 6 plants initially.
Rishikesh,
I can do it. I can do it.
what's the best email and telephone number to reach you if Jose wanted to reach you?
Shall I'll type it in the chat
Put it
box.
in the text box. Thank you so much. Thank you. Now, we have Susanna, do you want to add something here? You can see how our discussions are going. Would you like to add something?
Yes, I'm trying to add yoga therapy to Ayurveda here in France.
So we will have, Susanna, what we will have in the Ayush Valley webinars, we will have a webinar or more dedicated specifically for yoga therapy. We are putting the people together.
Oh, nice.
So we will have some discussions, and there'll be more than one webinar on yoga therapy in particular. So please join us, keep in touch with us.
Nice, nice. I think yoga therapy is good too. Join to Ayurveda, and I would like to promote this in France too, of course, and help French people with Ayurvedic diet and routine.
Thank you so much.
I think it's good.
Yeah,
Wonderful.
We'll be delighted to join with you. All the people in the group here right now and the Ayush Valley will be very, very happy to join with you. So please let us stay in touch and let us move this forward, because what you are saying is very important. People benefit from simple things, Ayurvedic diet and some yoga and very, very simple interventions benefit a lot of people. So thank you for raising this. We have noted this, and it's high on our list of priority in terms of activities for the future.
Thanks to you.
Thank you.
And
please,
hope Rasayanas could be sold here in France more easily too.
Well, we want people like you with us so that we have a local voice in France, whether it's Dijon, whether Bordeaux, or whether it's the very south of France, in Marseille. We want to connect with people, so maybe you can also guide us and make a network in France. Baswati ji also already connects with people in Normandy, and she has a lot of connections in Paris. So as this network grows, we want to get more and more people into France, so that people who are passionate about Ayurveda and Ayush systems in general. So we are happy you are here with us. We are happy Jose is here with us from Peru. And I want to see if I can get, and very happy that Vincenzo is here with us from France. We are already doing a lot of work with Vincenzo. And Thomas Pfeiffer is here from Prague. Thomas, would you like to say a few words? And Gayatri is here from Germany. So our network is growing very fast. Derek is here from South Africa. If Thomas doesn't want to add, I have Sanjeev Kumar Nath. Sanjeev ji, namaskar. Sanjeev, are you with us? Hello. Sanjeev? Sanjeev is not there. Giovanni is joining us from The Hague. Giovanni, no? Hello. Giovanni, are you there?
Good afternoon. Good afternoon.
Oh, Giovanni, hello. How are you?
Good afternoon.
How is everything in Hague?
I have not so much contact with people in Netherlands. But
where are you talking to us from today? Where are you today?
Yeah, at this moment I'm at home. This,
Where is home?
At home.
Where is home, Giovanni? Is it Hague?
It's in The Hague. In The Hague.
Hague, good. Okay, that's
yes.
what I thought. I hope you enjoyed our discussion today.
Yes, thank you. I was today busy to shopping because I'm alone,
Okay.
and I must be ready to watch your webinar.
I'm very happy that you have joined us and that you could
Yes,
share,
yes.
you could see what we are discussing. And
Thank you. I was on the middle
yes,
of
but
discussion of your.
we are
yes.
happy you have stayed on and that we are talking to yourself.
Thank you.
Giovanni works on some aspects of energy medicine and
No, not energy. Not
okay,
energy.
tell us about your
No.
system.
My system is not so difficult.
Symmetry medicine.
No, symmetry body.
Symmetry body. Uh-huh.
This is the name of my treatment.
Mm-hmm.
I do everything with movement and exercise and sport, not more.
Okay, good.
This is my concept, and I wish to treat the first 300 blindness on the world.
Thank you so much.
I asked to present Narendra Modi to support some clients to me.
What is the connection between your system and yoga? Is there some overlap?
With your system, you mean?
With what you do and with yoga?
No, nothing.
No, nothing.
Absolute nothing. No. I'm symmetry body. I'm very apart on this world.
Okay.
This is
you are the only person doing this symmetry body.
Yes, symmetry body. I'm the only person on the world that brought symmetry body on the world, and I'm the person that have knowledge, insight about this work. And this is a new job, and we are at this moment in crisis, and people have no money. People in Europe is very skeptic about new job, newling on this world, and I think the best way for my concept is in Asia, not in Europe.
Okay. What we should do, Giovanni, maybe in one of our future presentations, you can tell us a little more about what you're doing and or how symmetry body works. We'll be very interested in knowing, because there are many people here who are keen on some aspects of movement and health. So we will leave it like this. Thank you so much for joining us. I want to see thank you, Giovanni. I want to see if, thank you for being with us. There is somebody, Midun. Hello, Midun. Midun? Hello. And I also have Murli Das. I don't know if Murli Das is still with us. Murli, hello. There are people still signed on, but they're not. I don't think they are here with us. Murli, are you there? No, I'm happy. We have today with us. We had a good collection of people, so I can really thank everybody for being with us and staying on. I can see Sanjeev Kumar, and also Binoy. Binoy, are you there? No, and somebody from Ayurveda Care. Yes.
Sir, I am here. Binoy is here.
Oh, Binoy, namaskar. Binoy, please tell us, Binoy, introduce yourself. Binoy is MD and he works in public health. Binoy, please tell us a little bit about yourself, because there are a lot of people interested in what you're doing.
Yes, sir.
Binoy is located in Varkala, I think, in Kerala. Binoy, am I right?
Yes, sir. Yes, sir.
Varkala, please tell us a little more about where you studied medicine and what you do, because you also run some wonderful webinars.
So, good evening, all. Actually, I'm Dr. Binoy Babu. I am basically from Varkala in Trivandrum in Kerala. southern part of India. I have done my MBBS from Maharashtra, and after finishing my MBBS, I have done my masters in public health from Mahatma Gandhi University, Kottayam, and I passed out with the first rank. And I am working in Kerala Health Services as Assistant Director of Health Services. But right now I am on deputation and I am doing EIS. Like I'm working as Epidemic Intelligence Service Officer in the Ministry of Health in New Delhi. I'm working in National Center for Disease Control. I got the opportunity to be the central team lead for many, outbreak investigations like COVID-19. I'm very happy to be here. Maybe I'm the odd one out, and you all are the Ayurvedic and the rest of the alternative medicine systems. And I'm finding it very useful, and the network is so powerful. And thanks a lot, Dr. Madan sir, for introducing me to such a great, variety of this network. So what I would like to say about Ayurveda is like I am very much interested in Ayurveda, and I am not against any systems and all. And I would love to have an integration, which I was thinking from the very beginning of my career. And I was one of the persons who actually thought of starting when I was a medical officer in charge of a primary healthcare center in Kerala. I tried to call each and every person, like the Unani system, the yoga, as well as that Ayurveda doctor, as well as the homeo doctor in my locality. But strangely, I I didn't get a positive response from any of the persons. Like what I used to feel is like it is the choice of the people who has to choose, and each and every system will be having some benefit definitely for the society. So we should actually extract it and use it for the humankind. And one of my classmates, he was also instrumental in uh, uh, you know uh, increasing my interest in this Ayurveda field, because after finishing his MBBS, what he has done is his father was an Ayurvedic physician. He was MD in Ayurveda, and this guy, what he has done is like after finishing MBBS, he directly went to Ayurveda and he started to read all those things, and he started practicing in Mumbai. His name is Dr. Rohit Sane. I don't know any of you knows him.
Dr. Palat might know this person, Rohit Sane. Okay.
Yeah, he's running one of the best clinics in India. Actually, for the cardiac persons and all, he is running a very nice clinic. A lot of patients are coming, and he's those cases who are having this angiogram and all very positive, means without bypass and all. He is giving exclusive an Ayurveda package by which patients are getting treated. Really wonderful.
Could
So
you
I'm very
share,
happy to
could
be
you,
part of you, and please let me know where I can contribute, and I'll be there with you. Thank you so much.
Binoy, are you joining? Thank you for your comments. I now several questions. Are you, well, we had a lot of MDs today. You came in late, as you said, but we had about 6 MDs from modern medicine here with us. And I think we still have Baswati ji, who's an MD in modern medicine, public health person, who might still be here with us. I don't know, Baswati, are you there? Yes, Baswati is there. And we also have Dr. Karthikeyan from Chennai, a graduate of Stanley Medical College, MD, and a very successful ENT practitioner in Chennai. And these are all people who are very excited about taking forward a new way of thinking about delivering health for the people. So you are not alone, Binoy. Thank you so much for joining us. I want to see if Hari, who's our co-host today, whether Hari wants to add some thoughts here about Kerala. Hari looks after 4 NSS clinics in Kerala, Dr. Binoy. And this is the, Hari can tell us a little more about the clinics.
Yeah, well.
So, Hari, Dr. Binoy, you heard what?
Yeah, I heard. Dr. Madan, can you hear me?
I can hear you clearly. Thank you.
Yeah. Thank you. So I am so happy that Dr. Binoy is here, and he shared his experience of inviting, all doctors when he was in charge of a primary health center. So actually, this is what is supposed to happen in all the primary health centers. all these disciplines should come under the same roof. That when you go to a primary health center in Kerala or in India, you should find the modern medicine practitioner. You should also find the Ayurveda practitioner. You should also find the yoga practitioner. And if it is in Tamil Nadu or Kerala, maybe a Siddha practitioner as well. Or if it is in other parts, maybe a Unani or a TB practitioner. Why not? So this is pluralism, and that is wonderful. And Dr. Binoy, what he has shared with us is so brilliant. And this is actually there in the plans of the Ayush department. It was there. I'm not sure how much it is implemented all across India, but it is it's a dream, yeah, that people have the choice of going to a primary health center and they can choose. And Dr. Madan, what I do, I run these hospitals for the public trust called the Naya Service Society, which is a non-governmental organization of social, cultural, and educational nature in Kerala. So we run 120 schools and 20 colleges and some healthcare institutions, including modern medicine hospitals. We also run an engineering college and a homeopathic medical college. We have an Ayurveda medical college also at the auspices of our organization, though it is in the cooperative sector. So that is what NSS is doing. And we have started Ayurvedic hospitals for the last 20 years. And I'm lucky to be the first appointed Ayurvedic physician in the NSS service. And now we have 4 hospitals and 1 Ayurveda college to say about. So it has been a tough path, but it was nice. What Dr. Binoy said, if I was invited to even a chat with the primary health center doctor, I will wholeheartedly accept and go there and have a chat with the doctor or help him out in whatever ways I can. Like we have been doing with the Iravi Peru Grama Panchayat, where I have been, I'm located in one of the hospitals. So there, they had a project of reverse quarantined persons' healthcare. So it was medicine distribution as well as consultation and advices about lifestyle and diet to people above the age of 65. So the Panchayat identified more than 1,000 people. And so just the government doctors could not do it. So all the private Ayurvedic practitioners represented by the Ayurveda Medical Association, we went there and we did these camps. And that was during the COVID lockdown. Yeah. So it was very brilliant effort. And we are following up with the Panchayat to see how many of those who were taking these preventive medicines got COVID, you know, because we did that for the reverse quarantine people. So it was, so it is all very nice to work with the public health people, and also to work on ground at the community level and also on the level of the primary health center. Thank you. Thank you.
Thank you, Hari. Binoy, are you joining us from Delhi today or are you in Kerala?
So right now I am in Kerala, sir. Actually, I am assigned as a mentor to one of my junior doctor, and she's doing 2 research program here. One is completed and one more is pending, and half of the work is over, and one case control study is going on.
What
So
is the study about?
that,
Is it COVID related or something else?
Yeah, it's COVID related, sir. First one was a descriptive epidemiology, and the second one is a case control study.
What is your intervention on the case control study? Is it with any help?
Yeah, actually, we got a hypothesis. Like, you know, all of the persons, they were telling that, you know, our hypothesis was, you know, that they were transmitting the disease from a market, which is there in this place in Kundura. So we are just trying to find out whether this is true or not.
Okay, thank you. Now, could you, Binoy, could you tell us a little more about your work in Delhi? Because what you're doing is very important and you are a very important actor in all those activities.
Yes, sir. Actually,
National Center for Disease Control.
Yes, sir. Actually, what we are supposed to do is we will be the first persons who will be on the field if there is any type of outbreaks or natural calamities. So what are the first thing that has to be done? These things will be, you know, we will be giving after assessing the conditions or the situation, we will be addressing the state government or the local government, and we will be giving them advice like if it is a calamity, like what are all the initial steps to be taken, and what priorities should be we look for. And in the case of outbreaks and all, we will be the persons who will be confirming the outbreak by comparing the data and all. For the last previous years data will be extracting from the IDSP, and then we'll be confirming the pathogen through in the government lab and all. We'll be sending it, and we will be checking whether it is a positive case actually.
Thank you. So, I just want, for people who are still with us, I just want to.
And in that case, then
please.
What preventive measures that we need to take, that we will be doing. Then one more thing what we used to do is like the surveillance system, already established surveillance systems, if they are there. For example, now in Delhi we are having a ARI surveillance system, that is acute respiratory illness surveillance system, which was established in 6 major sentinel central government hospitals. So I was very fortunate enough to go there and do an evaluation of the existing system. So I have done it, and that abstract was also published, and now we are waiting for the that manuscript also to be published. We are also given that public health action that needs to be taken, and the evidence-based recommendations are also given. I was also fortunate enough to give my technical inputs on making the national program for climate change and human health. So that is coming up. It's actually it is started, and it was in the beginning stage, and under that there are many programs like the green concept. So I was also fortunate enough to give my technical inputs in making it a green infrastructure for all the institutions which we are having, not even modern medicine but for all, like Ayush and all. Also that ARI respiratory system, I was able to that surveillance system I was able to establish in Kerala with the state's interest. Actually, that time it was Sri Rajiv Sadanandan IAS, sir.
Yes.
And he was very keen to implement it and compare it with the air quality index in 3 major districts in Kerala, namely Trivandrum, Calicut, as well as Ernakulam. So now it's started functioning, and it's running very smoothly, and I'm very happy to see all those things. And they also asked me to be be the state trainer for making a state action plan for climate change and human health. So I used to travel from Delhi to here, and we used to meet the state nodal officers, and the training programs were arranged, and we had a lot of discussions. And afterwards, the first draft is ready for the state action plan for climate change and human health.
Will you be happy to share with us in one webinar some of these details about the environment and health and the action plan, if it is at some point when you are ready to share it with, because there are a lot of people who will be interested in learning a little more about these things.
Yeah, definitely, sir. Definitely. What I have to do is I have to take a permission officially.
Permission, of course, whatever you can. We will come back to you, Binoy. We are so happy that you are here with us, even though you joined us late. In a few minutes, you have shared a lot of knowledge that we are all keen to learn about, not only people in India, but people from other countries. From Peru, we have somebody, we have Susanna from France, and we have Thomas Pfeiffer from Prague. I think Thomas is still with us. And Baswati ji is here with us, MPH, public health person. So a lot of people are here who are excited, who will be excited to learn about this thing. Now, there is somebody with a telephone. There is no name, but it just displays as 906355. You are permitted to speak. I don't know who you are. Please introduce yourself. Hello. Whoever is with the telephone 90 identified as 9063 55. No. I see, I don't know if that's Bernie, signed in as Colasso. Is that you, Bernie? Bernie, hello. Bernie? Is that, I don't know if it's Bernie.
Dr. Madan, Dr. Majid raised his hand. Did you observe that?
I can't see. Is that Dr. Majid with that 906355?
I don't know, but he raised his hand actually.
I want to see if this is Bernie. Is it Bernie Colasso? Hello. Or is it Camilo Colasso? Hello. No. We are, Hari, I think we've done the rounds here. I don't know if Karthi wants to add something. Karthi, I don't know if you're still there.
Yeah.
Karthi?
Yeah, I am.
We are fortunate that you have stayed. Thank you so much for staying with us. You can see how our events go. We have about 2.5 hours of discussions, and here we are. I want to introduce Karthi to Binoy. Binoy, as you heard, works in many places in Delhi and in Kerala. And Karthi is especially interested. Karthi is an MD from Stanley Medical College, and in Chennai. It's a wonderful practice in Chennai, but his passion is autism. And Karthi, over the last 20 plus years, has been running a big organization called DOST, and the website is dost.org.
Dose.com it is.
Dose.com.
Yeah.
And so Karthi is very interested in this big public health issue, autism in children. And he feels there are many interventions from Ayurveda, Siddha medicine that are greatly helping children. So Karthi, this is just a way to introduce you to Binoy.
Yeah,
I will share Binoy's details so that we can, have these discussions also in New Delhi at some point. For me, the incidence is quite high. NCDC should become more sensitive to issues like autism. I leave this with you, Karthi, for a moment.
Yeah. Yep. You're still unmuted.
Karthi, are you there?
Yeah, I am here. Yeah.
I don't know if you wanted to just add a few words on where you would like to see some more engagement from Delhi NCDC on autism.
Yeah, I would love to. And then I would love to interact with him and then share whatever we have gathered down the line, and then he can guide us like where to go and how to go forward, kind of. I would like to do that because I was about to mention his name and then you did that for me.
Thank you. So I think Binoy has just shared his email address here.
Yeah.
drbinoy@gmail.com. I will send you Binoy's WhatsApp contacts also.
Yeah.
Straight away. Now we have Rajesh. Rajesh ji, namaskaram. Rajesh is joining us from Kerala. Rajesh. Trying to unmute Rajesh. Rajesh, can you? I don't know if Rajesh is still with us. We have also Camilo Colasso joining us from. Camilo, hello.
Hi.
Hi, Camilo. Camilo is joining us from Cambridge. Camilo founded, he's a PhD in immunology, and Camilo founded a company about 2 decades ago here in Cambridge called ImmunoBio. So Camilo, welcome to the group. You've joined us a bit too late. We had a lovely discussion early on. The recordings, we have preserved the recordings. They will appear in the Ayush Valley website. Now, you've joined very late in the chats. We have people here, Susanna joining us from France. We have Jose joining us from Lima in Peru. We have Thomas Pfeiffer joining us from Prague. Baswati joining us from Manipal, Udupi in Karnataka, and several other people here who are fascinating. What we should do, Camilo, can you hear?
But then he just wrote in the chat,
sorry.
There is no mic.
No mic, how come this is?
Please look at the chat.
Okay, let's see. Let me see if I can bring Camilo on. My screen is okay. Camilo, can you hear me? Hi, Camilo. Hi, Camilo. No, I think we've done the rounds here. There is one person who's with that telephone with 906-355. That's what I see. I don't know who that is. No more responses. Harthi? Hi, no mic. Sorry, I don't have a mic here. Okay, that's fine. Baswati? You are here. Baswati, please.
Wondering if we could just have a little discussion before you hang up.
Thank you.
With Harikumar, you and me, and anyone else that wants to join in. About the conclusion of this, this particular theme, which is what I saw is a bunch of people who, let's say I don't know any of them. There are people who are Ayurvedically trained, but working in pharmaceutical language in a modern way to try to compete with the kind of paradigms of modern pharmaceutical language, which is this whole, this thing going on between Ayurvedic drug manufacturers being compared to top 20 pharmaceutical manufacturers. What is first of all, Harikumar, what do you think about people who are Ayurvedic practitioners, at least trained Ayurvedic practitioners, trying to put everything in medicinal chemistry or biological chemistry language, rather than embracing srotas and doshas and gunas? I didn't hear the talk about anything about the clinical actual parameters. So I'm just wondering if Harikumar, if you could kind of tell
Baswati, before I pass it on to Harikumar, let me just intervene here. The point, that's me trying to put the top 20 drugs. I keep presenting that slide for a simple reason, which is to enthuse people to look bigger. So I'm not implying by presenting that slide, I'm not implying that we should go and isolate those molecules, and that is not what I'm presenting. What I'm saying is there is somebody out there, there are people out there who are occupying a very large canvas. They're corrupting the discussion. They're corrupting the narrative. I'm not implying that you should follow that route. I'm saying, watch that space. This is what they are proud of. This is not what should be happening. We
Very
want
good.
to, yes.
So that is what people like Aditi, who don't know, need to hear. Because when you talk to people that are less able, less intellectually able, and I need to say that because, I deal with patients who are really, really, I don't know how else to say it, they're really dumb. They really don't get what they need to do, which is why they've taken themselves down the rabbit hole of being as sick as they are, many of them. Like if you try to explain to them that they should scrape their tongue or brush their teeth, they will have an argument with me about why it's a waste for them to brush their teeth in the morning before they eat. So you're talking about people who are very sick because they have systematically brought ama into their body and don't know how to get it out. And they definitely want to use Ayurveda, but they definitely don't want to listen to any of its tenets. People like this are not just in the patient world. They're also in the Vaidya world, because I've met some very low intellectual Vaidyas who somehow passed out with their BAMS. They're in the MBBS world. I've met many, I didn't actually know this before, but apparently in India, in the private medical colleges, you can actually pay money and get entrance into medical school to become an MBBS. It's not based on your NEET score. So what is your level of competence? You just pay the money and you get your degree. So those people are a little bit less able, and they end up being the people that listen to your slide about the top 20, and they are convinced, and they are the ones that come to people like us, like Dr. Hari Kumar, Dr. Jammi, or myself, and say, well, if Ayurveda really worked, then why isn't there any evidence for it? Or, well, until you can show us the active molecule, how can we possibly allow Ayurveda to be in our medical system? It's dangerous. And I listen to these kind of things, and they react to the kinds of slides that you put up, because they think that that is not just the dominant language, it's the true language.
Thank you, Baswati. I think Hari will have a lot to add here.
Please.
Because, I think also Camilla will have a lot to add here, and maybe Binoy also will have a lot to add here. Karthi also will have a lot to add. Jose from Lima has already sent a message. He says, I think you have to focus on people that can understand, and don't lose energy in convincing people that maybe never are going to change. Oh.
Beautiful. It's a beautiful answer. Unfortunately, some of those people that never are going to change are the legislators. They are the people that run the government. And that's a big problem.
Well, this is one of the reasons, Baswati, why I put that image there, because I don't think our policymakers understand the scope of that penetrance, you know, the kind of scope and the scale at which it operates. And I keep highlighting this figure saying, you know, the entire health budget for 2021 for entire India for 1.4 billion people is less than the R&D spend for one pharmaceutical company.
But then you're setting them up to compete against numbers.
No, I'm not setting up to compete with anybody. I'm just saying, wake up and say, is this what you're, you know, how are you visualizing? What is your worldview here? Number one, you don't know how many villages there are in India in terms of policymakers. Number two, you don't know the population for any of the states. And what are you crafting these policies for? We have the same difficulty with the national education policy. Somebody in Delhi is crafting policy which doesn't connect with what is needed.
That's because they all went to schools in America.
Well,
and they imported all that stuff here.
Yeah, so this is a difficulty, and Binoy ji can add, but I want to hear Hari's.
Well, let Hari, yeah, Hari, please speak.
Thank you.
Yeah, Pastorji ji, I hear the anthropologist in you speaking when you say about medical schools and paying for your MBBS and all that. But anyhow,
is it true?
Yeah, it is true. It is true. It can happen. You can buy your education. Yes, we have a private education system everywhere in this country. So I would like to say, adding up to what you said, you find good practitioners and bad practitioners in every system. And for Ayurveda also, you find good practitioners and bad practitioners, definitely. And the point which you have raised, speaking about numbers and also speaking about, medical research, modern parameters, all that. Yes, the Ayurvedic physician who is working on the village level or the primary health center level, or a practitioner who is dedicated to his practice, actually don't need to bother about all these parameters. He needs to bother on srotas and whatever parameters you have suggested. I agree completely to the epistemology of Ayurveda. But I would like to quote also from Ayurveda, I hope you have come across this as well, which I used to quote whenever people said about why Ayurvedic graduates should know about modern medicine. It says, Ekam Shastram Athiyano na vidyat Shastra Nischayaha Tasmat Bahusrutam Shastram Vijaniyat Chikilsakaha. I hope you have come across this. If you have,
yes,
yeah,
I use it in all of my presentations.
Exactly. So the Ayurvedic practitioner should be knowledgeable and well heard or studied about all
different
the
sciences.
Bahusruta Shastras, all the well heard streams of knowledge. So this has been thought about even during the classical times in Ayurveda. All the Bahusruta Shastras were followed. So now the Bahusruta Shastra is modern medicine. Now the Bahusruta Shastra is pharmacology. Why not? So my point is, yes, I hope you followed the argument of the purist and the integrationist. There are purists and there are integrationists. They have been there forever. And the argument is continuing and it will continue. But there need to be purists and there need to be integrationists too. And there need to be also people who work from Ayurveda in different aspects of knowledge, not just in medicine, but even in other aspects of knowledge, in philosophy, in the ethics of medicine. Ayurveda can contribute a lot. So all this come together to form the whole corpus of Ayurveda. And I will rather say, when we speak only about some aspect of Ayurveda, we are also like the blind who try to see the elephant. We don't know many aspects of Ayurveda even now. So I would rather request everybody in the field to have the humility to recognize this. We should have the humility to recognize that we still don't know many aspects of Ayurveda itself. But at the same time, we have to show the respect to people who try to integrate as well, to those who try to keep the purity as well. This is my point. I think I was clear on that.
Thank you. Thank you very much. I think that it's fine to have those different sciences, and certainly people like myself and Madan, we are versed in several different sciences. What my issue is, as you said, we need to have people respecting each other. That also goes this way, where we need to have modern medicine give Ayurveda space as well. So maybe they don't have the shloka. They don't have the shloka in their science because they believe in dominion and they still have this imperialist view kind of dominating the way that they run things. But, you know, I am in a freedom movement like we were 100 years ago against the British. I think Ayurveda is running that freedom movement against allopathy, because allopathy is set to annihilate everything that we're doing. Yes, there are problems in Ayurveda, partly because we don't get proper facilities and resources for proper education, but also because we have a lot of people who've sold out to that system because it's slicker, it's more vogue, it's more beautiful, it's more sexy. And yet, when you see Ayurvedic people who are trained in BAMS and therefore have their registration and the right to practice, they go and they hunt around in allopathic medicine and they realize that there's something, you know, there's something deeply wrong with it. There's something going on that's wrong. And then they come back and they start opening up their old books that are sometimes now 10, 12, 15 years unused. And they say, now I see that Ayurveda actually takes care of all of these problems that this young infant of a science called modern medicine is starting to come across. And we already dealt with that for thousands of years, or at least tens of centuries in Ayurveda. And what I am impatient about is bringing that knowledge to the Ayurvedic physicians so that they will stand up and find the language that is proper for helping move it to a global world, but not doing it in a bastardized way that kowtows to the English language. Like this beautiful conversation we had earlier about
mistranslatable and non-translatable words. You know, I'm so sick and tired of people saying rakta is blood and rasa is plasma, because then the person that's learning Ayurveda for the first time says, oh, so it's rasa dhatu, and that's plasma. And then what they do is they limit their ability to understand. So when I'm teaching my students, and I say, I'm teaching right now, chapter 6 of Ashtanga Hridayam, we're doing the Shakavarga, and I'm talking to them about the dhatus, and someone says, well, isn't it moving into the fat, the medas? And I have to remind them that medas is not just fat. Modern medicine is finally discovering the difference between brown fat and white fat, and fat that turns into immune cells, and fats in their various roles. But until modern science discovers it, they are limiting Ayurveda by demanding that it speaks their infantile language versus speaking the language of what it is. So I agree with you that we need to have the, you know, the bohu, what shall I say, the wide knowledge across disciplines. But I will say that when they wrote that, I think they were talking about the 64 kalas and not the weird sciences that have come up in the last 50 years, where one science can't even talk to the other, and their science truths keep changing every 5 years. I don't call that science. I call that probing. And it's like a child in a transient state trying to grow up. I just have a hard time, after studying at some of the best schools in the world and listening to these doctors and scientists, I have such a hard time taking them seriously.
Thank you, Baswati. And you're hitting the nail, many nails on many heads here. And there are several people here. There is still somebody with a telephone. I think it's a telephone 906-355.
Well, I'm wondering if Dr. Harikumar wanted to respond to what I said, since.
Yeah, just to add one point. Yeah, I said when we are gliding from one system, or when you are having a dialogue between two different systems, I think it is always helpful and interesting when you have some mutual respect and some common grounds. I'm saying this because I'm also sitting on the institutional review board of a modern medicine medical college in my town. I'm the chair of the IRB, Institutional Review Board, which actually gives the ethical clearance for any modern medical research to happen in that medical institute. So I'm sitting together with the principal and all the other faculty members, not all, but some of them, and also some others in this ethics committee. So I don't find it difficult. If you have a certain common grounds and respect, and also the wish to learn from the other system, but without forgetting your own core, I think this is possible. And mutual respect and also humility for all reasons, I think it is quite helpful.
Right.
Now, there are several, thank you, Hari. I think very, very important points we are touching on. You know, this can become a body for a whole new dialogue. We have so many people here who might want to add. So I think, as far as I know, talking is permitted for all. And Baswati, you have raised your hand, so you've done. Binoy.
I'm wondering if any of the people from Ayush Valley Foundation who are the guides, like Dr. Girish or Dr. Jasila or some of the others, might want to make some comments, because they also are around.
I don't know if they are. I don't know who is online right now. I can see Karthik might want to add something. Karthik.
Yeah. See, I am neither here nor there. I am an ENT surgeon, but I integrate the traditional systems to treat autism, which when I started in 2002, 2003 was, pronounced as untreatable. And when I ventured into this field, I was almost a laughing stock for all the people. Actually, I started with, when I started my Dost Institute, it was Dr. Madhusudanan who practices here, an Ayurvedic physician. His mother lighted the lamp. And actually, Dr. Madhusudanan sent me to Coimbatore Ayurveda College to meet Dr. Krishna Kumar and then discuss with him the possibilities that Ayurvedic science can offer for this. And Dr. Krishna Kumar was very happy that ENT surgeon is entering into this fray. And he said, like, when Ayurvedic physicians do some research and then open the topic, actually, they have done a study on tinnitus, and they didn't take it forward because the ENT surgeons were not coming forward to work with them. So that is the state of affairs when it was in 2004, and it is still the same. And I'm a integrated, I'm an integrationist. I want to integrate these systems, but at the same time, I don't want the original system to lose its value. Actually, I want to add on to the value of it. So,
Karthi, yesterday when we were talking, you gave a few examples. Could you, to go deep into the technical aspects about the ENT condition that was solved with just a few drops of this oil that you have?
I think yesterday when I talked to you, I was talking from the patient's perspective. See, the patient who is suffering doesn't mind whether he is treated by an Ayurvedic physician or an allopath or a Siddha. What he wants is only a relief. And when the relief comes in a non-mutilating way, he is very happy. And that is what we all should aim at. You know, we should forget the thin barriers which exist between us. And then in sharing knowledge, we have to find out which is the common denominator, which is, kind of uniting us. And all these years I've been steadfastly believing that inflammation is the main thing which every system wants to relieve, and then that is the molecular denominator. And whoever gives alleviation of the inflammation in the least, destructive way wins. So if we could prove it in many areas, yesterday I shared my experience with Professor Madan about me treating a patient with lichen planus and a patient with a cirrhotic liver with moniliasis of the esophagus, 90 years old, shuttling from one hospital to another. And with the medication, he could become much better within about 14 days. He's so happy. And he was a non-believer in the first day. Second day, third day, he put all his belief into the system. And such way, it is only the question of we proving our mettle in difficult cases, which definitely in any country, even in US or UK, people are struggling to treat autoimmune disorders. They are struggling to treat psoriasis, and they are struggling to treat all the neurodegenerative problems. And in all these sectors, we can definitely deliver a lot of molecules which are, effective. It's only the question of we linking the languages in the way that they can understand, the medical people can understand, and also like the winner takes it all. There is, we have to deliver. And when we deliver, people don't mind. The medical professionals also don't mind, because like when I started my Institute for Autism, I wanted to choose autism, which is a no man's land and nobody's baby also. They were, see, like an autism kid would be shunted from a pediatrician to psychologists. Psychologists will shift it to OT and speech, and then ultimately it is only a software control, and the hardware never gets controlled. So I wrote in my website that I am doing a hardware control through the traditional Indian systems, but I understand the whole process through the Western medical science. So that is my slogan for integrated therapy. And many professors who were neurologists, they told me, it's a good thing. And then there are people unofficially told me that I want this integrated, therapy or the integrated concept to be at least 6 months course, 6 months topic in MBBS curriculum. And that is what we should aim at. And then that is what I thought when Professor Madan was gathering all powerful people together. So if we achieve that, that is the day in which people will realize the importance of all this, instead of just talking about so many literatures which many people don't understand. So we have to concentrate on bringing out molecules which are friendly and which are patient friendly. And then once we build up volumes of patients, and we need not have to talk, and the patients will talk and the molecules will talk for us.
Thank you, Karthi. Now, I don't know if Baswati wanted to add something here, or Hari wanted to add something here. I think
I'm wondering why you're speaking about molecules. And as a physician, I'm wondering, and as a surgeon, I'm wondering why the idea of writing case studies about these autistic patients hasn't been more important as a way of demonstration. Why do we have to do clinical trials? I keep saying this during this session, but what I'm seeing is that if you can just explain the logic, you don't need to have a biochemical or a bioinformatics study done. You can just say, I did this, and I did this, and this is why I chose this drug and not another. And when I used it, I find that many of my patients just get better using a combination of sesame oil in their ears, which is called Karna Purana, and cleaning out their sinuses, and then adding in a rasayana for the ears. There's only 3 or 4 of them that are available as compound formulations in Ayurveda, and using something like Sarivadi Vati and giving it to the patient for 6 weeks and then watching them get better. I have had so many people treated for their tinnitus, which, as you said, is impossible to treat in modern medicine. And I do it in New York, I do it in France, and I show people how to do it. And putting oil in the ears is not that difficult to do. So, and certainly, if you're a child in India, in Bengal anyway, you had that done when you were a child every Sunday. So why is this not written up in clinical case studies and then just shown to the world, this is for tinnitus? Or giving Rasa Oshadhis is one of the best things you can do for a child with autism, depending on which part of the spectrum disorder they're on. But I find that bringing them fresh green vegetables to eat and preparing them in a way that works, building up their microbiome, absolutely shifts these kids. They become so much more functional, and depending on what age you get them at, you can shift them completely. Ramesh Vangal, who is, I've known him for some 17 years, he's now the head of Kerala Ayurveda Private Limited. His child is an autistic child who he has all the money in the world, and not all the money, he has a lot of money, and he went and looked for cures in modern medicine. He can travel to London, and he lives in Singapore right now. He was in the US. What cured him was Ayurveda. And that is why he went and purchased Kerala Ayurveda and has made it his baby, so to speak, because autism was cured. His son is now functional. And that is a huge thing for Ayurveda to be able to say. Why don't they write this up as a case study? I'll tell you why. Because people in the modern medical world want to blind the Ayurvedic physicians to say, unless you give us an RCT, randomized clinical trial, we're not going to believe what you say. And it's just not true. If you can show your yukti in a case series or a single case study, like the ones you see in the New England Journal of Medicine, where they have these bizarre cases and they show how they treated them, people will start believing. So I'm just wondering, Doctor, what you think, Dr. Karthikeyan, what do you think of case studies for either tinnitus or autism?
Yeah, I agree with your point, but with autism, we are only running on physiological markers now. We don't have a biomarker. So if we have a biomarker and we are able to prove that through this combinatorial approaches, because my approach is combinatorial, I use medicine, and I use dietary therapy, as you mentioned, and I use yoga, and I use lifestyle. See, like in lifestyle, I ask them not to use any of the electronic gadgets, and then all the LCD, LED devices are away from my menu. But take US, for example, the whole system runs on, iPads and applications. But I have several of the patients who have come from US, stayed with me for 1 to 2 years and gone back. And I tell them, don't tell them that you took therapy from India, because they are all biased. But they are wondering what made them change so much in 1 year or 2 years. But they all say that it is all anecdotal. No, if we have to succeed, we have to form a panel. We have to panel of physicians like you, molecular biologists like Dr. Madan, and public health experts like Mr. Ginay. We should form a team, and we should talk in the same language, that our aim is patient-centric and not towards anything else. And that is where we have to target. That is the audience. Because I tell the parent when he comes to me, I won't be even offering you 5% improvement in 6 months. 99% of parents say, even if you give 1% improvement, we are happy. See, that is the kind of plight that autistic people have. And it is a huge iceberg. And again, they run from pillar to post, and then the riches to rags story is very true in autism. And
Yes.
if we prove our mettle in autism alone, we can win the world. All the top 20 companies, pharmaceuticals data will be blown to pieces, because there is so much of money. So I tell them, like, we have to win smiles of the parents. Once we win the smiles, see, look at the numbers of autistic people compared to diabetes and other things, it is so much. So we have to build the coherence. And if we build the coherence and then make individual semi-independent, at least at the age of 18, we have done the job. And I am sure the Western medicine is still struggling, and the people beyond 21 struggling to cope up. And I don't know what happens. And every parent goes to bed thinking, what will happen to my child after me? And I'm talking to you so emphatically because I have lived through it for the past 20 years. And I know their pain, and then I know the gratitude and the parent-to-parent reference I have. I have people from all the countries coming over here and then getting treated. Now, post-COVID, I'm completely changing my approach, because people cannot travel, they cannot travel to another country. So unless I change my attitude and then the kind of thing for which I need some biological, evidence to prove that it is working. See, even if I am able to, I was, centering my whole thing on serotonin metabolism, because if I correct the serotonin, the whole thing will get corrected itself. And now the Western medicine is waking up to that particular fact, but they do not have a molecule to control the serotonin. We have so many tools with us in Ayurveda, in yoga, in the meditation, other things, everything work on the control of serotonin metabolism. But we are not rising in one voice. We are all scattered. And then I don't know whether we are differentiated by ego barriers or one-upmanship. Everything is bothering us. And that is my view. I don't know whether you will accept my view, but I had a relationship with a genomist in US. He was very, passionate about Ayurveda, and he ran a program called Genomic Ayurveda. He used to come to Tirupati University and then lecture and all that. He was working on Amazonian forest herbs. And he said, Karthi, we can give expression to Ayurveda only by genomic language. That is why I coined this thing as Genomic Ayurveda. And then, unfortunately, he died about 4 years back. And that is what I expressed with Professor Madan. We need to talk in terms that they will not dispute. They will not have a iota of doubt about the efficacy of these molecules because it is expressed in genomic terms. And that is the way the world is going. And if we combine all our efforts, concentrate on herbs and concentrate on the formulations, and then leave the argument about single molecules and synthesizing and all that. A combinatorial herbal molecule can work, but only thing is we have to find out physiologically, biologically, how it is working in different biological platforms and how the molecule alters the receptors and the cell signaling. All this is, talked in basic research. But if you analyze that, they do not have a therapeutic molecule to correct it. But we have a therapeutic molecule to correct it. We have to plug it there. And we have to go into basic research, tell them we have a molecule. And I don't know whether you have Martha Herbert with Boston. She was a pediatric neurologist, and I presented my cases to her, and then I presented this in Texas conference. She said, Karthi, I cannot match your eye contact, the way you develop the eye contact with your children. But this, she told me in 2010, but you are using a combinatorial approach, and tell me which is the component which is contributing to the eye contact. I said, I don't know. When I take a child and then apply this, within about 3 to 6 months, I have an excellent eye contact. I have an excellent empathy, and the empathy is followed by the speech. And I use a Carnatic music teacher to develop speech. I don't use a speech therapist. And even a non-verbal kid starts singing before he starts speaking. So these are the wonders we have in our country.
Karthi, what I'm going to suggest is that we have you with us to lead a whole program, a whole series perhaps on autism and Ayush systems. And I will discuss in the Ayush Valley team meeting, which we will have shortly, because what you are offering is very, very important. When we go into Eastern Europe, there are parts of Eastern Europe where autism is almost 25% of the problem. 25% of newborns have probability of shifting into autistic spectrum problems. So this is just a comment. We'll come back to this offline. I want to bring in a few more people here. Vaswati might want to add something here, but before that, I want to bring in Camillo, if you can. Camillo, you want to add something? Hi, Camillo. I see a raised hand from a mobile phone that says 906355. I don't know who that is. And I also have a new person here, Pilar. Pilar, you want to add something here? Pilar?
Hello.
Where are you? Hello, Pilar. Where are you joining us from today?
I'm in Madrid, from Spain.
Thank you so much for joining us. How did you hear about our event? Is it through Hari?
It's Dr. Hari, yes. He was here in my center giving a couple of courses and consultation, and it was great.
Well,
he was very
welcome to the Ayush Valley, and you can see the kind of discussions we are having. We are so happy that you have joined us, and very happy that you are here staying with us. And I hope you will join us in future events too.
Of course, I will like it. Thank you very much.
What is your background? Are you MD, or are you? How have you arrived into Ayurveda? What is your story?
Well, I come from the natural medicine and psychology, and I met the Ayurveda just a long time ago, 25 years or something, with Ayurveda Maharishi, and then I was there. I have a center in Madrid for 20 years already, and so doing almost everything, consultations and panchakarmas, and I mean, living courses. Education is important. So here we are.
we're very happy to have you with us. We have other people also from Spain. We had Daniela from Barcelona.
Mm-hmm.
We want to build a strong group across Spain and other locations too, into Portugal and Italy. We have Vincenzo Valenci, MD. So we have a lot of people. I hope you will join the Ayush Valley and strengthen our activities, because we would like that very much.
Me too. Thank you very much. I will.
So you're part of a big family here, and you can connect with us at any time,
yeah,
and ask your questions and learn a little more from all of us.
Yeah.
And we can learn a lot about your local needs and what is needed.
Mm.
Thank you, Pilar. We welcome you to the group and welcome you to the activities of the Ayush Valley Foundation.
Thank you, madam.
Camilo, can you hear us? Hi, Camilo. Camilo? I'm trying to get Camilo Colasso from, he's here in Cambridge, but I don't seem to be able to get Camilo. Camilo, you are free to talk.
I think Madan Camilo said his mic has some problems, so
Okay,
he has put up something on the chat. You can all read that.
Okay. Thank you. I think, Hari, we have touched a lot. I have one person from Belgium I want to just bring in, from Brussels, Elizabeth.
Oh, bloody Mike, he keeps asking me whether I'll talk.
Oh, well done, Camilo, you are here. Hold on. Elizabeth, you can come on after Camilo. Camilo, welcome to the group. Very happy to have you here from Cambridge. Camilo lives very close to where I am.
I can't talk, madame.
Please.
Hello?
Yeah, we can hear you.
Can you hear me?
Yeah, we can hear you.
Ah, okay, sorry. The mic's working now.
Yeah.
Oh yeah, all I was going to say was that the issue is that what Basmati was talking about was the Ayurveda is considered observational based medicine, just as case studies would be. And the problem is that the pendulum has swung completely in favor of evidence-based medicine, which is defined as double-blind controlled studies. And I think the COVID example will change this again and allow us to say something in favor of observational-based medicine. Because there are, for example, case reports about the use of anticoagulants, which have benefits, but are still not widely used because there's no double-blind controlled study. My argument always with observational-based medicine is that as a parent, you always use treatments on your second or third child that you know worked in the previous ones, which is essentially observational-based medicine. You don't do trials. So that's all I have to say, basically.
Now, I don't know if Baswati wants to add. Baswati, please.
Yeah.
I'm just letting Baswati come on here. Baswati.
Thank you. Thank you. I keep dropping out because I'm in Udupi, where the rainstorms interrupt the internet regularly. That was a wonderful comment that you made, sir. And, you know, it speaks to the fact that parents are not treating 10,000 children of other places and makes and molds and creeds and colors. They're treating their own children. And usually what they have learned is what their mother, their grandmother, their aunt has told them. Oh, well, you should try Scotch and not bourbon because this one is very good for this kind of fever or this kind of a cut. And so in Ireland, you know, bourbon is considered and Scotch are considered to be medicines. Whereas in India, the parents are going to use different things for their children because they know that it works for them. Now, does that mean that we are wrong and they're right, or they're wrong and we're right? It means that it's not just about observational, it's about individualized, personalized medicine in these different factors that as a medical doctor who's really studied modern medicine, and then a public health person that studied observational versus interventional trials, I think the brilliance of the Dasha Vida Pariksha, which means there are 10 factors that lend to the individualized treatment of each and every patient. And that's what makes it very difficult to write algorithms. So in your example, the parents already know those 10 factors for their children, their first one, their second one, and their third or fourth or whatever. And so they can personalize the medicine, and it becomes more than observational. It actually becomes a small sample size that's already weeded out 8 or 9 of those 10 factors because they're common to the entire family. And so for us to take what someone does in Cambridge with their 3 children and try to apply that in a different desha. Desha doesn't just mean the land, but it means the land of your origin. And that land of your origin goes back to your DNA 3 generations before. Why 3 and not 2 or 14? Because if you look at when your meiotic cells are made, they're actually 3 generations before. I carry the imprint, as do all of us, of our 3 generations before. And that's when those germ cells were made, and that's what was going on the earth. So let's say in the 1920s or 1930s for us. And so the desha, the idea of desha and the land that you're in predisposed, and it's borne out in epidemiologic studies where they see that people have certain tendencies for generations, then they shift location, and suddenly those tendencies change. So the observations that are being made are very small frames of reference by allopathic medicine, because they don't understand that there are actually so many factors that led to those key observational studies that are done by physicians. And physicians who are wise and with clinical acumen somehow know. I'll give the example. I was an attending physician in OB-GYN for some 8-10 years at this hospital in New York Presbyterian Hospitals, one of the community hospitals. And that guy was a modern medical OB-GYN doctor, and he could look at a woman, and just from walking in, he could say, she's going to be going into eclampsia, or she's going to be pre-eclamptic in a few hours. Let's get her to the hospital. And I would chase after him and say, wait, how did you know? How did you know? He said, I just looked at her. Get her blood tested, go look at her legs, check her blood pressure, just see. And I would run after him. How do you know? How do you know? You haven't seen whether she has protein in the urine. You don't know whether she has. And he would say, I just looked at her. What was that? Was that an evidence-based study? Was that a clinical trial? Was that an interventional anything? It's clinical acumen. And I have finally met a group of amazing clinicians here in Udupi who have that ability. And I ask them, how did you learn this? And they say it comes from watching keenly and being very, very perceptive. Very perceptive, and being somewhat empathic. And I think that every good physician, every amazingly talented physician has that clinical acumen, whether they are a Siddha practitioner or a homeopath or a naturopath or an Ayurvedic Vaidya or a sensei or an allopathic doctor. And I don't think epidemiology has even appreciated that which you just said, sir, because that parent who is, Dr. Mom, who sees her children and knows what to do, has that same keen sense of perception about her children, which is why she knows that this one needs chicken soup, but that one needs a steam inhalation for the same, quote unquote, same disease. So I'm absolutely in favor of renaming observational studies as something deeper. Thank you for letting me go on.
Praswati, I want to, before I let Camilo might want to respond here, I want to say.
Yeah, I think that was a very valuable thing, because I hadn't quite realize the second piece, which is, of course, is observational medicine. This is also personalized observational medicine, and that's what makes it powerful.
But this is what medicine is trying to do. I mean, it's trying to get, but it doesn't get it. It doesn't quite get the drift. Basically, it wants to commercialize. It wants. Baswati, the comment I want to, the question I want to you is, you gave us an example of Presbyterian New York. You gave us an example of seeing people with similar skills in Udupi. Is this a soft skill that is transferable?
It is a skill that is by Gurukul. It is transferable, but I will tell you that, so my guru, found me. I was an allopathic doctor, and he is Krishna Kumarji, who just passed, and he imprinted me. And I at that time was a pure allopathic physician. And what happened over the last 18, 20 years since he kidnapped me is that he taught me that the only way to learn, really learn, is one-to-one with the imprinting of jivana, which is life energy, from one person to the other. Now, is that transferable? Absolutely. But is it transferable from one person at the front of an auditorium that's 50 feet away to a group of 200 students sitting in that auditorium, and there's no personal contact and there's no personalization of where you are at? No. At the same time, Thirumulpaji had quite a following, and he was the one that gave me Vidya Rambam. He was a very famous Ayurvedic Vaidya who only started practicing Ayurveda at the age of his late 40s. He was a railway engineer. And then when he retired from that, he, at the age of 49, started studying Ayurveda and became brilliant. And by the time he was, 70 or something, he was sought after by everyone in Palakkad. He was a legend by the time he was 80. There's some background noise, by the way. Maybe you can mute out whoever that is. I think it's Majid PV, it looks like, has background noise going on.
Let me see if I can tell.
Yeah.
Is Majid here with us? Thank you. So apologies for this. I will
it's his dinner.
Okay. Let me see if I can mute him.
He's having dinner without inviting us.
Okay. I can't see Dr. Majid on my system.
Majid, yeah, he's there.
Can you, okay, Majid, mute.
There we go. Thank you so much. So he taught about, dozens and dozens, and, M. Prasad was one of his chief disciples. But what he would do is bring in groups of people. So it wasn't personalized as in only one-on-one, but it was 6 or 7. And over time, he would match them so that the batches that came were at a similar level of understanding. And so he would say to them, why don't you come next Thursday? Because he knew the Thursday group was a little bit faster in understanding. Or why don't you come on Friday? This was the remedial group that needed a lot of basic concepts taught to them again and again. And he just loved teaching. So he would just sit with them for 2 hours, 3 hours. They would come, from train to a bus to walking on foot to get to his front gate. And he would sit with them and he would just teach, and the tea would come out and they would continue, and then they would, just continue learning from him. It was a Gurukul that was not a one-to-one per se, but it was taught that way. So is it transferable? Yes. Does that happen in modern medicine? Absolutely. My skills in OB-GYN were really good because I trained with a man named Frank Merrick, a legend in Chicago, who was very old. He was one of the only people who could turn breech babies within the 7th or 8th month, which was, it's actually illegal now to do it in the US. And he was amazing. And he taught me, it was pure clinical transfer. Could I have gotten that sitting in an auditorium? No. So I think there is something special about clinical medicine where it's not just observation. It is a talented physician who transmits something that we don't have a biomarker for, but it's a something that comes to the student. You can call it inspiration, you can call it, life energy, jivana, but there's something there that does allow the transfer of that knowledge. And that is why as much as we go to the British system, which was considered superior from the time of Cambridge, 1100 something, and brought into every nation of the Commonwealth and the imperialistic world, we are slowly turning back to the one-on-one mentored Gurukul style of teaching once again, realizing that the classroom leaves people void of certain, I don't say they're only soft skills. I think there's something more there. There's something about the ethical reasoning. There's something about the personal that interfaces with the professional in that moment. And you can see the personal by the way that people are speaking about their teachers. There's something very personal that goes on in a professional environment. And I've seen every person that I've talked with, including you, Madan, the way that you talk about your PhD mentor. We have that deep personal connection to people who do something that is amazing. They could choose not to teach us, and yet they still do. They could just discard us because of our ignorance, because of the darkness within us, and yet they choose to continue to explain to us the Vimshadi Gunas until we get it. Or they will explain again and again about Sankhya until we understand those damn 68 sutras. Those kinds of interactions are so precious, and Ayurveda really gets it. It's not that modern medicine doesn't get it, it's just that modern medicine is putting a price and a premium on, what did you call it last week? Upscaling and scaling up. As though upscaling is superior. It is not superior for many things. It is not superior. Even if I'm doing a polio campaign, having a personal relationship one-on-one guarantees you're going to get a better outcome for that child that you are vaccinating. Why? Because 4 in every million cases of polio vaccination end up with the vaccine-derived polio, and those kids who are healthy end up getting freaking polio. They end up getting sick. And so the parents are afraid, but if you connected with them personally, they will come and they will report the disease. They will seek out help. They will get medical intervention, which is something that's not going to happen when you have scaled up medicine. This is not a can of Pepsi. This is healing on the deepest levels. And I'm so passionate about this because I've seen what modern medicine has done to destroy and buy the souls of young medical students. I've seen it for the last 20, 25 years. They will say to me that they have no desire or need to learn how to use a stethoscope. Why should they? I've had students argue with me, why the heck should I learn how to use a stethoscope? We're going to order an echo and do an EKG anyway, and those are objective measures. You would never believe me if I told you what I heard on a stethoscope anyway.
No,
we've lost it. Yeah.
I think you've raised, I accept that as a slap on my wrist here in terms of upscaling and scaling up. What I'm saying perhaps is that in our attempt to connect the invisible with the invisible, that can also be upscaled and scaled up. So,
see, until you have interoceptive abilities in people, you cannot teach them what perception is. It is so difficult for me. Every yoga teacher, like the 2 therapists that we heard that are from France, I can sense their energies. I can sense, one's name is Pilar. I could sense her energy. I know, right? Now, how did I do that? Why do I do that? That interoceptive ability not only goes from me, it goes from me to other people. But if you don't teach people interoception, they can sit there forever and they're not going to be able to perceive the basic things. They can't perceive pulse. Yeah, go ahead.
So this is Pilar and Suzanne. Thank you for being with us because you're adding greatly to our discussion. Now, I want to, I don't know if Camilla wanted to comment on this. We have several people
Madan, I want to say something to me after.
Ciao, Vincenzo. No ciao. Please. All yours. Vincenzo, please.
Yeah, I can. Okay. What to say?
Vincenzo, before you Vincenzo, before you start, I just want to make one comment,
Let him speak, Madan.
Hold on, so that I want to guide this thing a little bit, because Vincenzo will add, but I want to just correct the thinking a little bit. Vincenzo, not far from where Vincenzo is the Italian village of Vinci, V-I-N-C-I, which is the village of where
Leonardo
da Vinci came from.
Esatto.
So now, Vincenzo's comment is, Leonardo did good things whenever he did that, but that doesn't work today.
But let him speak.
Okay, so here we are. So, okay, Vincenzo, all yours, please.
So, I hear just the last word of Bash that are very intriguing and very truthful. It is a great problem because many people are not able to have a perception, aware of sixth sense o terzo occhio. Traduci, madame, terzo occhio o sesto sense. We lost the magnetic sense, particularly that drive fish and bird in their life. And this is a great, very great problem and that we must understand better. Of course, some research that was presented in Coherence 15 years ago in Rome University about neurons as an antenna rich transmittente, electromagnetic or something so, help us to understand that our brain is able to receive information from far and send information. If the nature of this information is not so clear indeed, and David Boom spoke about this information has hidden information in the network of communication. Now here we are discussing, we are voice electromagnetic sonoro a wave that arrive, traduction, etc., etc. But other function work on this connection, and for example, me, I can do to Madan or Basha diagnostic of their chakra, your chakra, and I can correct it. Or if you have stomach ache or headache or pain someplace, I can see your position to someone where is, can choose the good funds anti-inflammatory to that go to manage your inflammation, or you go to improve the state of your chakra with the connected physiopathological therapeutical effect for pain or other. So a lot of things must be observed, studied, measured, and developed. And in the reality, in Kiev, Ultimate that produced some device for measuring meridians, electrical status, develop also some technology to measure the aura and the chakra, the field of aura and the chakra. And so now we must connect it with this advanced technology to test and develop and validate them together with the stronger development in biophysics and quantum chemistry, because we must develop a good physics applied to biology, a good quantum chemistry, because we must see what this signal, what this low energy, what this invisible got to work on chemistry, on the dynamics. Otherwise, we stay in an unfair position facing with the scientific community, because we seem esoteric people, but we must have a transition from mysticism, mystics to science, also in this area. And this is, I think, our goal. We can organize we can organize an international school to teach this experience that is clearly exposed by Bash, because this we must improve the sixth sense, the magnetic sense in people. Only in a few people, because I have many good colleagues, many good people that want to teach, learn it, but they are not able. Because we have some block in our perception, in our nervous central system of perception, of vision, and a lot of people is not able to enter in contact with this system, or need a lot of time. But this is important school, because this goal to improve the ability, the skill in diagnostics, in perception of the world, of the life, of disease, and a lot of things that otherwise you need the super software, very expensive, and not always in your hand in every situation. So a school on it, we must think to organize. So of course, a good school, you need a good clinics where you can use this practice and develop research on this practice. So as we discussed with Madame, we must organize something very strong in the only place where it is something possible, that is India, because you are great respect for this, your tradition on subtle body, on chakra, etc. Also, if you have a difficulty not only with the Ayurveda, that is herbal therapy, but chakra and the subtle body are more difficult to impose. Just the yoga go okay a little bit, because it's a good exercise, relaxes, etc. But a few people know indeed what happens. And we must increase the scientific standard in this area and develop a good physics of this phenomena that's connected with the work of David Bohm, Aronov, and other scientists. Now, Alan Wisdom are working also on it, but we need a strong theoretical physics. Now, Alan is fired in Boston. I need a place for him in some place, maybe Cambridge or India. Madame, do you understand? So you must organize something for Alan.
I understand completely, Vincenzo. We will discuss this
later.
We will discuss this, but you have raised a very important, I think you have conveyed very clearly answer to Baswatiji's comment that there is a skill, but not everybody has that skill. And we must find how to improve that skill, or maybe find out who are the people who have that skill.
Teach this skill to good people that are idoneous. Not all people are idoneous to fly, to drive air flight aircraft of war, of aircraft to normal flight.
Yeah,
this is a work just for a few people. No, this is a work for only a few people.
Few people, very well said.
We must select just idoneous people to be teaching in this initiated teaching, on this in this way, in this potential.
Thank you so
much.
With
a good high level of science, biology, physics, etc. Because we must avoid the guru. Okay, they are very good. their nation, their tradition, their Leonardo da Vinci, but we must have another target.
Thank you. Thank you. I don't know, Baswati, did you want to comment on that? Baswati, you're there? Baswati. Let me see.
Bash, where are you?
Basha is there. She will come. I think she has some problems in the network from where she is. Baswati. I also see Massimo from Roma. Massimo, ciao.
Hello, hi, Madam. It's
Massimo,
nice.
Thank you so much for joining us. You joined us very late. We had some good discussions. Hopefully the next one you will be with us, Massimo. And
Okay.
you should, and because I would like to introduce you to everybody here in the network. Massimo is from Rome. Massimo and his lovely wife, Julia, from they both are in Rome, and Massimo runs a very important video channel called Veggie Channel. So Massimo, you want to tell us a little bit of what you've been doing, and also if you want to comment on what Vincenzo just said. Vincenzo is in Firenze, not far from you, just 2 hours away from you.
Thank you, Madam, for inviting me. It's an honor for me to have the chance to be in this meeting. And honestly, I still have to figure out the subject of this meeting, so I will be listening to you and to the other guests. Concerning about my activity on Veggie Channel, we are promoting a plant-based diet through interviews with scientists like you and many others around the world, who have very interesting things to tell us about the possibility to live on this kind of diet healthily in following the science. So we speak about this, about diets, and about more ethical lifestyle. So I will be pleased to answer your question maybe later on if you want.
We will, Massimo, thank you so much for joining us. Thank you, number one. Thank you for adding this. I've just shared with everybody the link to your Veggie Channel. And we have many themes in common with Massimo. Massimo used to work for the European Space Research Organization, working with satellites. And after at some point, he decided to stop working for the European Space Research Organization and decided to do what he loves best, which is to go around the world with his video camera and connect with people and share whatever he learns from interacting with people. And Massimo, what we do when we, in future events, when you join, you will see where our thinking is, what are the things we are discussing today. Vincenzo offered a very important point, which is also close to your heart, about human extra powers in human beings. One of Massimo's special interest is people who live without food. And Massimo follows these people around the world, people who, they're called the breatharians, they just live on prana. And Massimo has documented many of these people from different parts of the world, and he continues to explore people. He goes to events where these people are there who live on only so-called non-food energy. And Massimo documents and he presents it. So here we are. We are lucky to have Massimo with us. Please join us in future events. And people here at the Ayush Valley will love to have you with us with your documentation skills, with your Veggie Channel events, so that we can send the messages from Ayush Valley to more people who are interested in these kind of areas. We have been on air now for a long time, and we've had some wonderful chats. Thank you. So before I pass the floor to Hari, who's going to wind down the event, I have one last look on my screen to see if there are any more raised hands. Karthi has a raised hand. Karthi, would you like to add something?
Yeah, nothing much, sir. I was so impressed with the kind of telepathy transfer of knowledge, and then the intuitive medicine and the observation medicine. I'm thrilled at listening to all that. And
Karthi, we are lucky here because you are an MD. Vincenzo is an MD. He studied medicine in Rome at the Sapienza, the big university in Rome. And we have Baswati, who studied medicine in America. And we have so many other people here and Binoy, who's MD and MPH. So we are so lucky to have these people. I think this is the future of some of these interactions, very rich interactions. And we are so fortunate that you have stayed with us and you are adding to this discussion. We could go on for hours together, but I think the back office at Ayush Valley wants to go home. They want to have dinner.
Yeah, that's it. Yeah.
So I leave it. So thank you all. Thank you.
Thank you so much.
Run through the list here. Thank you, Aditi, for joining. Aditi and I will have a chat later. Pilar, thank you for joining us from Madrid. Jose, thank you for joining us from Lima in Peru. Giovanni, thank you for joining us from The Hague. Camilo, thank you for joining us from Cambridge. And there is one person who I haven't located, Chinna. Chinna, I want to let Chinna speak if Chinna is still here. Just a few words. Chinna, you are free. And Karthi, thank you so much. Vincenzo, thank you so much. We'll talk later this evening. Massimo, thank you very much. Baswati, if you wanted to say your last few words before we go offline. And Binoyji, thank you so much for joining from India. So you can see the power of our connection, the links, and the future of communication is going to be like this. Hari, no more comments from anybody. You can
conclude, yeah.
Conclude. Thank you so much for being with us. Yeah. Now, very important, the role you play in your medical college. Could you tell us a little more about your medical college before we close this session?
Yeah, I work as the chairman of the Institutional Review Board of the Pushpagiri Medical College in Tiruvalla, which is a modern medical college. That happened shortly after I came back from Germany. They invited me to the IRB, the Institutional Review Board. And later I was asked to take charge as the chairman of the IRB. So it actually started because the main person who is a Catholic priest, who is the director of the medical college, he had a problem with his toenails. And he was put on the surgical theater on the table, and they were almost going to take his nail out. And he was still suffering from pain, even if given the analgesia. And he just walked out saying, "I'm not going to do it." Then he came to consult me, and I did it with Triphala decoction and a lepa. It was healed. And then this grew, and once I came back from Germany, he asked me to join the board. That was actually the connection. But anyhow, I did enjoy, and I'm still enjoying what I'm doing at the IRB. Also because there are ethical questions which I can ask from the part of a layperson, from the part of an Ayurvedic practitioner, and also a part of the medical anthropologist in that forum. And I also can have a very good exchange of the medical research, what is happening in the institute. So that is what is happening at the Pushpagiri Institute of Medical Research in Tiruvalla.
I hope you will tell us more about it when we meet next time.
Sure. And the commenting and the concluding remark I would like to make is, my professor, as you all mentioned about your mentors, my professor in Heidelberg, William Sachs, is an ethnographer and a professor of medical anthropology. He did a presentation at the All India Institute of Medical Sciences in Delhi, and he was speaking about spirit possessions And all the doctors and the scientists at the All India Institute of Medical Sciences were so skeptic that they almost drilled him with questions on possessions, spirit possessions, etc., which you can read in his books, William S. Sachs. He has a book on the goddess of justice, which is on, most of his writings are on the Gadwal part of the Himalayas. So William Sachs says the Indian mind is much more radical. The Indian mind is much more, finding empirical reasons to understand anything. So we heard from all the panelists as well as our participants who were there in the discussions, Indians and otherwise, but we also heard the skepticism from both sides from our panelists. And also we had a brilliant discussion with our members other than the panelists in the Stantish after the discussion. And that was also quite enjoyable. We touched energy medicine, we touched different aspects of medicines, including the experience-based medicine aspects. It was very nice and brilliant to hear from you all. Thank you so much, Madan, for gearing this and nicely gliding over all these premises, which are quite interesting. Thank you, Paswati ji, for all the brilliant and vibrant, very energetic inputs you have added on to this. I have been hearing my baby crying already for the last one, or at least a half an hour. And so I have been on and off trying to appease him. But at this, I could not leave the Stantish because of the really captivating discussions which were happening here. Thank you, Dr. Madan, and thank you all the brilliant souls assembled here. Pishajam Sathuvrutanam, Bhadram Agama Shalinam, Apyasta Karmanam, Bhadram Bhadram Bhadra Pilashinam. I will not explain the whole verse. I will explain only the final word, Bhadram Bhadra Pilashinam, which means Bhadra Pilashi is one who would like noble and good things to happen for everybody. We are all people who follow Bhadra Pilasha, that nice and positive and brilliant things happen, not just for us, but for the whole world. Dr. Madan, Ayush Valley, Paswati ji, all our speakers, the doctor who spoke from Chennai, all of us, everybody, thank you all. Let noble and good things happen for all. Namaste.